So we are recording.
Okay. So hi, everybody. Thanks for being here today. I'm Rob Steiner. We have here Kristen, Stephen, Crystal, and Andrea. And these people, I'm surrounded by people who make me shrink because I am no doctor, but you are all doctors and nurses. So please introduce yourselves.
Okay, well, thank you very much for having us. I'm Kristen Nagel, co-founder of Canadian Frontline Nurses. And yeah, so we're just bringing together a team of nurses that our voices are being silenced and just trying to get our voices heard. And we've been connected with some amazing doctors like Dr. Stephen Malthouse across Canada that are also trying to get the message out. So I'll pass it over to Stephen.
Yeah, hi everybody. I'm a family doctor on the west coast of Canada, and we're in the same situation, I think, as the nurses. That many of the doctors are not speaking out because of fear of reprisals from their colleges, and also going against the public health measures which have been rolled out across our country. And we're also trying to gather doctors, but also nurses and chiropractors, naturopaths, all the different medical healthcare professions together under one roof. And I'm the president of the Canada Health Alliance, and it's a pleasure to be here. I'm going to pass it on to Crystal.
Well, I echo that. I also feel it to be a huge privilege and honor to be here with all of you. And I'm a nurse practitioner in Southwestern Ontario. Haven't technically been practicing the role of a nurse practitioner for over 3 years now, because I was noticing that there was more and more things that were a conflict in terms of my conscience. And I slowly backed away from that role and entered into the Ministry of Long-Term Care in an inspection role to be able to sleep peacefully at night, knowing that I wasn't violating any of my conscious beliefs or moral beliefs. And I am part of the Canadian Frontline Nurses with Kristen.
Andrea.
Well, good morning to everybody. I'm a medical doctor and even a DDS, so I'm a dentist. But since February 2020, in the pandemic coming to Europe, we're on the front line because we had the first cases. And well, of course, I had a friend who his parents were ill about COVID, very bad situation, and so I went to their house and tried to treat them, and well, they were out of COVID in a few days, even if they were over 93 and with a lot of comorbidity. How did I start? Just thinking like a doctor, not looking at protocols, not looking at guidelines, but just trying to think that it was a pneumonia and I had to treat with antibiotics, even if it was viral, and with hydroxychloroquine, because as you know, Mr. Fauci, Dr. Fauci in the United States has written something in 2015 about hydroxychloroquine. And he wrote his, if I remember his words, something like hydroxychloroquine works against the SARS. And in my opinion, in next years, if we'll have a new pandemic, a new epidemic of new virus, sorry, it will be the first arm, the more important arm we will have against this pandemic. And so I started to treat. After a few days, I understood that the problem was worse of a normal respiratory virus, because I understood they had a lot of problems that could be understood thinking to this COVID like autoimmune pathology. And so I said, well, hydroxychloroquine is a autoimmune medicament, but also if we need to prevent autoimmune pathology, we use cortisone. So I started to use cortisone. After around 10 days, They made in Italy, in near Bergamo, that was the center of the pandemic situation in Italy, with a lot of deaths. So an anatomopathologist made of the bodies of the dead,
We
and
lost him. Oh, he's back.
okay, sorry. And so the anatomopathologist said we have thrombosis in these cases, and so we start to use also heparin to prevent it. And so I started. After that, well, 13 months, something like that, I treat something like more than 500 patients. And well, I had two lost, but both are dead in hospital because of one just stepped down and had a trauma with his head, and so went to hospital. And the other one had cancer, the pneumonia cancer, and so is that of death. So I think that our treatment is not bad. Of course, I changed a lot my my guidelines with other medicine like ivermectin that is working very good. I changed also kind of antibiotics, not only azithromycin but also levofloxacin. But the idea is always the same. I add also the vitamin D3, and vitamin K2. But in the mainstream is always the same thing. So we treat with anti-inflammatory, not to let the virus expand in other tissues, and we use hydroxychloroquine or ivermectin with azithromycin or levofloxacin, uh, corticosteroid to prevent the change of the COVID in autoimmune disease, because we think that in around 10% of people we have a gene, something like that, that give this disease a new approach. It means that it's an autoimmune medicine, because when the generic immune system has done his work, it began to he begins to produce antibodies, specific antibodies, anti-SARS-CoV-2, and this is the clue. It means that this is the moment where some people have this change. It begins to produce antibodies, and the autoimmune system, I mean the immune system, begins to react in a exaggerate way. So the disease transform itself, and so we have first to block the inflammatory system. I mean the inflammatory situation. Then we have to block the reproduction of the virus. Then we have to prevent the transformation of the of an autoimmune disease with cortisone. But we also have to have a second parachute. So we give them heparin, enoxaparin, to prevent the production of microtrons. And then we have a last one, that is the more severe cases, when you don't begin in the first days or in the first week, and you see patients that already have microtrons, and this is the case to use urokinases to solve microtrons. But this is something that you can do it in Italy just in hospital. The problem is that they don't do it. They don't use it. That's very, very bad, I suppose. If we treat every patient from the beginning, I suppose that we could save everybody. I said everybody. So 100% of patients.
So, Andrea, if I'm to understand this correctly, people should no longer be afraid of COVID because COVID will not kill if treated properly and within the first 1 or 2 days after the onset of the symptoms. Am I correct?
Yes, absolutely.
So COVID is 100% treatable. And this is the message that we wish to convey, not only to people in Italy and Canada, but people throughout the world who are being locked down and are being harassed by the police and by their politicians because they are trying to convey a different message. That is, you are all going to die from COVID. And if you don't get the vaccine, you are all going to die. Okay, now we also know that a vaccine, especially here in Europe, I think it's the same probably in Canada, a vaccine gets authorized only if there is no alternative cure. And now I know that for a fact that Andrea and the team of colleagues in Italy wrote the Ministry of Health right at the beginning, way back in, I think, was it March last year, to tell them that, look, we have a therapy. People can be cured. People don't necessarily have to die. And what was the answer of the Italian government? Nothing. Silence. They were just
yes,
ignored.
They don't. Yeah, exactly.
They
Yes,
were
I
ignored.
was not one of those that wrote to the government because at the beginning I was totally alone. I mean, I was a medical doctor like Stephen, and that in his conscience tried to treat them, but I was alone. I didn't have colleagues that helped me. After a few months, I realized that I was not alone, that a lot of us, well, a lot is maybe too big, like we were, I don't know, 20, around 20 in all Italy, but we were um, alone, treating all in the same way. So when we met, Professor Cavanna, Professor Garavelli, Professor Capucci, Dr. Mangiagalli, Dr. Zmuski, and others, we were treating all in the same way, and so we had the same results. That was great when we met. So we said we have to stay all together and explain to the world what we are doing, what we reached. After that, Robert can explain you better. We try to go against the government, light guns, the Italian medical authority, the Italian medicine authority, pharmacological authority, explain them that the protocol that were forbidding hydroxychloroquine was bad, that the protocol that said you have to wait and just give paracetamol, it was the Italian guideline that was terrible. Where they made, in my opinion, maybe 50,000 people die. That was bad, and we won. We won at court. After that, we were in contact and we met the vice minister of health in Italy. That is a doctor. And we were to Rome. We were in two people, Professor Cavanna. I don't know if you know who Professor Cavanna is. It's just a country doctor in a small hospital. He's an oncologist. And like me, he made the same thing. And in April 2020, he had an interview and he got the time copertina, aiutami Robert.
The cover.
The cover, yeah, cover of time cover in April 2020, like the doctor who flattened the curve. Now he's in his sorry, he's in a candidate. It's a candidate. Sorry,
Yes.
he's a candidate at Peace Nobel Prize 2021. I'm sure he will not get it because we have also Greta Thunberg, Black Lives Matter, and whatever. But it's something. So we were together to the Vice Minister of Health, and we explained what we are doing very simply. And we found a man that was a doctor that understood what we are saying. For example, when I was speaking about a gene that I suppose is involved in this change of the illness from viral infection to autoimmune uh, severe autoimmune illness, he said, "Well, I'm supposing that is HLA gene," and he gave me something that he printed in literature, so we could understand one each other. We were speaking the same language. After that, 8 days ago, the Italian Senate made a vote on the proposition to ask to the government, Italian government, to make guidelines to treat COVID at home, not only in hospital, not for waiting like before, but treat with our medicines COVID at home by doctors, of course. And the vote was amazing because we have, as you know, many parties in Italy as usual, opposition, coalition, or whatever, and all the Senate voted for this motion, and only two people vote no against this. So we are waiting now from the government to make new guidelines. We hope they will reach what we need. That's a normal, simple guideline that help people to be treated at home
Mhm.
like a flu. Well, it's a severe flu, of course, but it's a flu in maybe 20-25%. It's a severe flu. But if you treat them very in early treatment, outpatient treatment, you can save them all. And so you can reopen, as Rob Steiner said before, you can reopen everything.
Okay. Well, now we know that Canadian doctors are also aware that COVID is not the bubonic plague. And as a matter of fact, Dr. Mouthouse put together a video, which I understand is 11 minutes long, and it's entitled Canadian Doctors Speak Out, Top Reasons Not to Be Afraid of COVID. And it can also be found on CanadaHealthAlliance.org. Can you tell us about it?
Well, a group of doctors, we got together. We decided that the main thing that was driving this was fear. In fact, all we're hearing on our mainstream media is, propaganda and fear mongering, really. And it's a great way to get people to do what they're told and to give up their freedoms. And of course, this comes back to what Andreas was saying, is that, there are plenty of treatments that are highly successful for treating COVID disease. Particularly if you get it early, it seems to be very effective. Even in later stages, it can be treated with the protocols. So we felt that the important thing was to try to undermine this fear, which is stopping people from thinking through the problem themselves. And so we put together this 11-minute video. And it's the first time that Canadian doctors got together and decided we were going to speak out together about, first of all, do we even have a pandemic? We showed the evidence that is actually not the case. We don't have an excessive number of deaths. And then we looked at, is there asymptomatic spread? And we found that the evidence pointed that there was not, that if you don't have symptoms, you cannot spread it to other people. And that means, you don't need to wear masks if you don't have an infection. In fact, lots of studies have shown that masks don't work. Then we looked at children. We saw that children don't actually pass infections up to adults or to their teachers. They rarely have symptoms. Statistically, the death rate in Canada is zero. I think we've had 6 cases, and with several of them, or most of them, have had, or even all of them, we don't really know, have had comorbidities. That they didn't really die from COVID as much as they died with COVID. So we looked at a number of different things like that, and all the treatments that are out there that people can use. Just as Andreas was saying, I mean, you can start off with hydroxychloroquine, azithromycin, and zinc supplement, and that's going to take care of a lot. But if you add ivermectin, inhaled hydrogen peroxide by nebulizer, ozone, high dose vitamin D. I think glutathione is being used. But when you get on further, you can use inhaled steroids. You can use, injectable steroids. I mean, depending on where you are in the spectrum of the disease, because as Andreas was saying, towards the end, when people actually get sick, really sick, and go into the ICU, it's not because of the virus, because the viral loads are actually quite low at that time. It's really because of the cytokine storm. The immune system gets turned on, and that causes generalized inflammation, with specifically, more particularly in the lung fields. And then we have superimposed pneumonias. So, antibiotics may be required there. So we decided we would put something together to try to undermine that. And I think we had a very successful. I would encourage people to go and look at that, because it's also something you can pass around to your family members. And you probably won't be able to show it to your doctor unless you've got it downloaded on your cell phone. And they've got a whole 11 minutes to spend with you.
But I also understand that it was banned right away.
Yeah, it came down off YouTube, I think, in 20 minutes, but it's up there again. They may have thought that we weren't bad enough to be banned. But you can see it at the website, CanadaHealthAlliance.org. And just Andreas, what you were saying, I mean, this is very similar to what Peter McCulloch, who's a medical doctor. He was in Texas, who was just speaking at the Senate meeting there, saying exactly the same thing. And in fact, they, with the American Association of Physicians and Surgeons, have put together a pamphlet. His feeling is, if you go to your doctor and you are diagnosed with COVID disease, whatever that exactly is, then you don't just get sent home. You get sent home with a pamphlet and a telephone number that you can call if you're having trouble, and giving you some things to use at home in the early stages, which will stop this in its tracks. So people don't need to be afraid of this. And they've got to, I think the key, they've got to turn off their TV set, because that's where all the problem is coming from. And also, I think that if we're going to be relying upon our government agencies and our public health and our hospitals, who are all, following some kind of a script here, because it just does not match reality. There's been so much reporting of successful treatments, and everybody is being, in the medical field is either complicit, compliant, coerced, hypnotized, under a spell. We're not sure what it is, but that's where the medical profession is. It's really tragic.
Now, for example, Crystal. Sorry.
No, if I may say something. Well, as Robert Steiner knows, I'm not a no mask. I mean, I think at COVID, you don't have to have fear of COVID, but we have to respect him. Like you respect the ocean, but you don't have to have fear. You respect mountain. I mean, you don't have to have fear with mountain, but you have to respect it, to know it, and so act. I suppose the mask is very important. It's the only shield we have. And after that, about younger people, about children. Well, I treated a lot of children, a lot. In third wave, we are in the third wave now. And I have an idea of why we have to treat a lot of younger people. It's not a question of variants, but in my opinion, it's a question of new reinfection. Because if I'm right, when the first time a Peru doctor, Professor Edwin of Cuzco, that it's in intensive care hospital, he said to me, Andrea, was at Zoom like this. It was around 3 months and a half ago, is that we are seeing in our hospital a lot of young people that after 3 days from the first symptoms come to the hospital in a very severe situation. I suppose there a new variant, a Peruvian variant. Well, I tried to think about it, and after half an hour, I called him back. I said, "No, listen. If the cytokine storms has been made by immune system, by antibodies, specific antibodies, it's not possible that any variant could give you a cytokine store because they don't exist yet. Because the immune system is not able to produce antibodies in 3 days. So I said, the thing should be something else. I suppose there were young, strong people that without any comorbidity that already made the COVID once, but totally asymptomatic. They didn't know it, but they have the memory of the gene, of the SARS-CoV-2 gene. And so in the second infection, their immune system is ready to product antibodies, like a Kalashnikov. When you just use it and you take it within your arms very strongly, you can shoot where you want. But if you lift it in the air and it comes down on the floor, it starts to shoot everywhere. Ta 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 ta. And that's it's happened, in my opinion, with these young guys. They have this gene, and in the first infection, they didn't have any problem because they were strong and whatever. But in the second way, maybe with a high viral load, when the antibodies it begins to produce the specific antibodies. When the system begins to produce specific antibodies, it gets crazy and it starts creating the cytokine storms, even in young people. We are losing people in our hospital. Of course, they are just 1%, 2%, but we don't have to forget them. Anyway, I also had some Canadian patients here. Well, I should know, but he's a friend, so I say his name. All his family was got by COVID, and I think you know very well his name because his name is Villeneuve. He's a former Formula One champion, and his children got the COVID. Of course, I treat them from the beginning, and they didn't have any problem. Now they're out, but don't undervaluate these cases because I've seen young people with problems. I have, for example, a 25 years old girl that I treated in March, but March of last year, so 13 months ago. And I got her after, I say, 2 weeks of COVID, and she didn't have the cytokine store, but she still have problem with one of her pneumonia on the right side. She has a part of the pneumonia that doesn't work totally. So this is the long COVID. Anyway, we treat long COVID a lot with ivermectin. And you were speaking, Stephen, about Peter McCulloch, that I know, and I agree totally with him, with Professor Harvey Risch of Yale University, but even with Professor Peter Corey. Peter Corey made a wonderful lecture 10 days ago with us, for us, and he showed the Mexico City data And what was amazing, if you look at them in December, you take the month of December 2020, and you will see the curve that was very high of people in hospital and problem at home or whatever, and the curve goes down suddenly on December 29th. Why? Because the town start to give ivermectin kits to anybody that had a positive swab. And it's amazing. They didn't have any more hospitalization.
Okay.
Steven. Robert, sorry.
Okay.
Well, I all I can say is, this is what's good about it, Andrea, that first of all, reading the mask literature and so on, I would say that masks do not work, in fact, cause more harm than good. But what is good about this? We may not agree, but at least we're discussing is having some debate, which is what we really have needed from the beginning, but has been blocked. So if doctors like you and I can get together, we can agree to disagree, and we can try to work it out. But we're not seeing that. And this gag order, I think, has also gone right into the hospitals because nurses aren't allowed to speak out either.
And we have a couple of examples right here. We have Crystal and Kristen who have paid dearly for their dissent. Crystal, do you want to tell us who wants to begin? Kristen, Crystal.
Want me to go ahead, Kristen?
Yeah, take it.
All right. I knew almost instantaneously when this whole so-called pandemic was declared way back for I guess us in March. It was not based in anything. There was no evidence to support any of the measures that were being implemented. And so I was, by word of mouth, explaining to everyone around me and also posting on social media everything to just contradict what was being enforced, and with the hopes that people would start to think critically for themselves. But there's such a fear associated with what's going on that it's paralyzed everyone's ability to think logically and to think critically about what's going on. So essentially what happened for me was that I was attacked because of my social media posts on Facebook by media outlets criticizing my views because they were obviously contrary to the narrative. And because of that, I was investigated by my employer for 7.5 months. And then following that, I was terminated. And I was encouraged by my union rep to basically refrain from posting anything that would be seen as controversial on my Facebook page, in the hopes that would be saved, essentially.
Oh, we're losing Crystal. They're boycotting her.
Yeah.
And personally, with family, with friends, have you lost me?
Okay, we got you back, I think.
You still hear me?
Uh-oh.
Are you able to hear me now?
Okay.
You're,
comes and goes.
Yeah.
Okay, I think we got you back.
Are you hear me at all?
Maybe not. All right. While Crystal tries to clear up her problems, do you want to tell us your story, Kristen? I mean, you are one who paid very, very dearly, just like Crystal, you paid with your job, your dissent.
Yeah, same thing. I knew, I totally agree what Dr. Malthouse was saying about having differing opinions. And that's why I think it is so important that we continue to be able to ask questions, have hard conversations, to learn from each other, maybe even unlearn, to relearn. And that's why the silencing and the censoring of our voices is so dangerous, because even amongst this group, I think there's a lot we agree on, but I think there's still a lot that we disagree on. And I think that's okay, because it just goes to show how much still we need to learn and how much growth we can still do, and that we should always be asking questions to always learn to do better. That's part of why we're in this field that we're in, because we want to continue to learn and help and do the best that we can. And I come at it from a different perspective. Although I've been a nurse for 14 years, I've been a holistic nutritionist for the last 6 years. So I come about it from, the mind, body, spirit approach, and realizing that we are not just physical bodies of, bone and muscle, that we have actual divine, spiritual, and energetic properties within us. And that can never be measured within a petri dish. So it's really, it adds a whole other layer of, complications and unknowns to how our body reacts and what actually is happening. And I have a very different perspective on what we're seeing globally. And, I have even a different perspective on what viruses are and what's even happening in contagion. And one of the things that I've been learning recently is just, well, not even recently, but that just how more prominent I'm seeing it happen, is how important our mind is, and how much our mind can really manifest symptoms and illness and cell changes and physiological changes within our bodies. And so when this was all happening back last December, over a year ago, we saw those images in Wuhan, and we saw people, collapsing on the street, and instantly that created a lot of fear already for people. And, so they're watching those images and they're glued, and already the fear is setting in. And, we kind of, even then I knew that, it was just a flu. It's kind of propaganda happening. But then come like March, and, then it's here, then we're locking down, we're isolating people in our homes. Kids can no longer go to school. Can you imagine that? There was so much fear that people felt in those days, in those first months, in those weeks. And people were scared to, go outside of their own house, to talk to one another, even like the relationship, the things with their own kids. Like if they had a runny nose, like even the parenting dynamic within your own child changed. And that fear alone manifests into illness and disease and symptoms. Right. Yes. And then all of a sudden you're going in and you have all these symptoms that you're now you're like, you realize you're like, not only was I afraid of catching it, now I have all these symptoms. So I do have it. So even you're telling your body, I do have it. You're going to get tested and treated, and you're treating these symptoms that are, the fear and what's happening. And then you get, the diagnosis of, yes, you're positive for COVID. And then it's like more fear sets in. So what's happening when all this fear is coming into the body is we have a physiological response. We're ancient beings, and we hold so much wisdom. I mean, how we've been on this planet for like how many, millennia, like how long, like our bodies know how to adapt. So when our body's put in this place of fear, our physiological response is to protect us, to create these adaptive layers. And this happens by, maybe it's increasing tissue, maybe it's increasing, water in our body. And when we get into this fear, especially, once we're, in that place of being ventilated, our body is in a massive state of fight or flight, and we're near death. And if you think about like, a fish out of water, the fish wants to be, encapsulated in more water. So it's going to create kind of like, water sources around it. And that's what's happening to the body. If you tell your body that you're going to die, if you are so scared that you're going to die, like your kidney tubules will shut down to increase fluid within your body, and to help preserve, and we're water beings, and to help create more water within us, to help, help us stay alive. But then we see those symptoms and we treat them, and maybe we run drips, or maybe we run extra fluid, and then our kidneys are still shutting down, and then we flood the lungs. And, that creates other issues. And we see that with blood pressure, and we treat, but, and we're kind of counteracting what the body's trying to do. And I come at that from a very different perspective, and, you can call it fringe, but I just think it shows that there's so much that we can learn and understand and take away from what actually is happening in the body. So that's kind of,
the problem I see with preventive medicine in general, which could be holistic, could be Ayurvedic, whatever type of medicine actually tries to prevent a disease, the fact that people will never see it. Because if some sort of medicine helps me stay healthy, I will never know that I could have gotten ill. Whereas if I get ill and a medicine cures me, I know it's that medicine that cured me and saved my life. So probably people are deceived by this, because, they don't realize that there is an alternative to getting cured or getting a vaccine, which leads me to my next question to all of you. What do you think of these vaccines? Stephen.
Ah, well, you know, you can look at it from, first of all, you have three things you have to look at. One is, do you need it? In other words, what is the really the mortality, the morbidity, you know, the deaths and the illness that is caused by the disease you're trying to prevent? Secondly, does the shot cause harm? And is that significant harm? And does that outweigh any of the third aspect, benefits? Now, are there any benefits? So I think you'd have to say, we don't need it. It's potentially very risky. We don't know all the answers to that because of the animal studies were so short, if done at all, and that the humans phase 3, we're still in it. Phase 3 studies. It's experimental drug, and we in the 2 months that was required, at least in Canada, before it was rolled out in the United States, that was not enough time to show that it didn't cause harm. I think if we look at the evidence, that if you look at the relative risk reduction, that means a reduction of people with symptoms, but not hospitalizations, ICU admissions, intensive care, and deaths. We see that it only reduced it from maybe 19 to 29%. That's relative. But if we look at the absolute reduction, it's less than 1%. So you're giving a shot which reduces symptoms in some people by less than 1% for a disease which has, in under the 70s, 99.5% survival rate. And as you go down below that, the survival rate's much better. And that's without treatments.
Exactly.
Right? That's with people who aren't even being treated, which I think, as Andrea was saying, you know, your chances of surviving COVID is pretty much 100% if you have treatments, which we do have, but have not been used generally. So there's no benefit. The harms are unknown, and particularly we see things like infertility. We see cross-reactivity with people's own tissues and autoimmune diseases, because, you know, of those spike proteins that we're supposed to be making, more than 20 of them are present in the human body already, including the placenta, which means that we could have infertility, which is high on the list. And if you think about someone who comes out and says, hey, I think you should take this vaccines, and in the next breath says we've got too many people on the planet, you better have some red flags go up that say that, you know, is there kind of another agenda going on here, which is not to do with stopping a virus? I like the saying that the virus was created for the shot, the vaccine. The vaccine was not created for the virus, because it will also bring in surveillance, which is, you know, another step down towards tyrannical control of the population. So we don't need it. It's potentially very risky and doesn't offer any benefits. So why would you have a vaccine?
Exactly. Crystal, yes.
I agree entirely with what Dr. Malthouse just spoke. And there is a sinister agenda. I know it. I absolutely know it. I mean, we've all been given discernment. And I think when we've got red flags going off within ourselves that tell us there's something more to what's going on here, and the evidence is not adding up, and we're not either, like I said, like there's just no scientific evidence for anything that's been implemented. And it goes against everything that we've ever been taught as medical professionals. And I would go a step further to say that we're seeing all over the internet now all of the negative consequences to these vaccines. We're seeing, you know, severe adverse reactions. We're seeing deaths as well. So, yeah.
So you're talking about red flags, but I don't see people walking around with a little red flag above their head. I mean, what is wrong with people?
That's the question. But I think, you know, as I was speaking earlier about fear and how that paralyzes a person and completely impairs their ability to think logically and critically about a situation, I think that has a lot to do with it. And in addition to that, I would say that there are very few people that question their government. There are very few people that think that there's the slightest remote possibility that their government could potentially be doing something that would harm them. And unfortunately, history shows us otherwise.
Okay, so we know, we trust our governments. Okay, now, this is what I've been talking about for the longest time here in Italy. No, some people, I'm talking like we, not as in us, but like we in general as a population, we trust our government. I would love to be able to trust my government. I would love to be able to trust my government, but that's why I'm here and I'm talking to you, because I've read so much about this COVID that I cannot possibly ever in a million years trust my government again. I mean, we've seen the ECDC, which is Europe's CDC, basically. It's, you know, the prime medical institution in Europe, tell us that the total number, the highest number of PCR and enhancements, what do you call them?
Cycle threshold or amplification.
Amplifications.
The amplifications, exactly. The total number of amplifications should not exceed 24. And now we know here in Italy that on average, they get amplified between 35 and 50 times, which is
45,
which makes
usually, 45.
Exactly. On average are 45. So we know that makes 99% of our PCR tests fake, false positives. Okay. And our government keeps on using them. They haven't replied to what the ECDC says. Okay, we know for a fact that we are counting people who die in car accidents or of a heart attack or leukemia or whatever else, just because they're positive to a PCR test. We call them COVID deaths. Mm-hmm. And so we know that that's a fake number, but we keep on counting them. So how can you possibly trust a government that does all this, knowing that they're doing it? And it's not an emergency situation. Now you've known it for a year. Okay, Andrea, what do you think?
A part of car accident with causative swab. I don't believe it. I still don't believe it. Maybe one day I will say sorry. I was wrong, Robert. For the other things, I agree. I'm not a no-vax doctor. I suppose that, for example, anti-polio was very, very important for the world. But, you know, I will still work for next 12 days for the Ministry of Health. Why I say for the next 12 days? Because I didn't get the vaccine yet. I didn't want it. Probably I will be fired like Crystal in less than 2 weeks. And my tweet profile has been closed yesterday because I wrote something about vaccine in English 2 days ago. Well, why do I speak about polio? Because working in the Ministry of Health, of course, I have all the email from OMS on my desk. Well, do you know?
Which is the WHO.
WHO, yeah, sorry. WHO. And do you know how many people in the world in 2020 got polio after the vaccine? Nobody knows.
How many?
Quite a few.
925 people. But I suppose that is better that 925 people got the polio after the vaccine, vice that millions of people get the polio. Okay? Mm-hmm. So I'm not a no-vax, but in this case, we have to manage COVID that is something totally different from the other infection disease we knew before. For example, you all know that you should never use antibiotics with virus. You said, Stephen, before we gave antibiotics to COVID people to fight against other infection that can be over the COVID. Well, in this case, I suppose that antibiotics can help us with virus SARS-CoV-2, and it's the first time. Second, cortisone. We know that you never should use cortisone for infection disease because it's block your defenses. but not with COVID. And well, the third idea I have that the target of a vaccine is to give you antibodies because normally antibodies protect you. They are a shield against the virus. Well, not in this case. Antibodies could be our enemies. So every vaccine that is made against SARS-CoV-2 that utilize uh, spike protein uh, makes antibodies that are dangerous. As I said before, we see reinfections, and reinfections are worse in many cases because they already have antibodies. So they risk cytokine storm, the autoimmune illness, more than the first time and more early because normally you take 10 days, 14 days to have a cytokine storm. If you already had antibodies, you risk it in 3 days. So you don't have time to start if you are not ready, if you don't have medicine in your house and a smart doctor that after 1 day of symptom starts with the therapy. So to give everybody antibodies, I don't know if it's a good way to treat COVID with a vaccine. Second thing, and last, and then I stop. They talk about, as you know, AstraZeneca, Johnson and Johnson, Pfizer, about thrombocytopenia, thrombotic events, piastreinopenia, and whatever. And they look to that vaccine. They talk about another vaccine. They all are the same. I don't say that mRNA, the messenger RNA, it's better than the others. Maybe it's worse. But the thing is not which kind of vaccine they are doing to you. Every vaccine uses a spike, and every vaccine that uses the protein spike can give you, of course, one about 10,000 people, one about 100,000 people, 1 million people, but it's very risky for those people, those cases, because of the spike protein that gives you antibodies. So you can invent other 25 vaccines that will have always the same protein, the same problem of thrombocytopenia, because it's inside the antibody with the spike protein.
So what would you like to say, and this is directed to all of you, whoever wants to answer first or all together, what would you say to someone who today is scared of COVID and who is lining up to get a jab?
I would say just go down to the end of your street and see how many ambulances are going by. Because, you know, if we really had a pandemic, you'd be seeing ambulances going by all the time.
Actually,
But
wait a
we're
minute.
not.
Why is it we've never seen someone drop dead just like we saw during the onset of this epidemic in China? I mean, I haven't seen it in Italy, and I don't think you've seen it in Canada either.
No, because those were staged.
Yep.
Those were staged.
No one drops like. But now we're actually seeing that from the shots. So people are dropping after the shots.
Yep.
Right.
They are.
So now we get to fulfill that theatrical presentation, but they never dropped from COVID. And you know, we don't really know what this COVID thing is all about, to tell you the truth. I mean, there's so many different elements we've seen, from air pollution with cyanide, from 5G rollout, from glyphosate to Roundup use in biofuels, and you know, the delta of the Mississippi River. Vitamin D deficiency, I think that plays a big role. And I think that if we, for example, the Malaysia study showed that everybody had adequate vitamin D levels, nobody died. So are we actually trying somehow stimulating vitamin D usage with some of the drugs we're using, which we think it's the ivermectin, but maybe that's actually stimulating the vitamin D pathway. I mean, it's we don't really know. And then there are other things too. People are vitamin deficient in magnesium and C and a lot of things, particularly in the wintertime. And there are so many different elements of this COVID disease. I hate to blame it on a poor little virus, which when people get hospitalized, their viral loads are quite low. It could be triggering it. It could be triggering the cytokine storms Andrea was talking about. Yeah, but these people are set up for it in some way. Vitamin D, we know, is a very good way of modulating your immune system to prevent these overreactions to coronaviruses. So, I know in Canada, back in March, I was trying to alert people to all the studies on vitamin D, and maybe we need to give that in our long-term care homes. And you know what? People were laughing at it. There's one email that said, "Well, those people up in the Comox Valley, that's where I live in Canada, they think vitamins can cure everything." It was insulting, and yet now we're seeing again and again and again that vitamin D has been shown to be essentially we have a pandemic of vitamin D deficiency.
Okay.
In my opinion, what I will say to people, what I taught every day, I say to people, but I'll tell you after just something. It's not true that COVID doesn't kill, even if we have less ambulance. Robert knows, maybe no, because he lives in Rome. I live in Milan. We had ambulance every 20 seconds months ago. I lost people that I knew very well that were without any other comorbidity. So don't underevaluate, please, COVID. Okay, that's real. Maybe, like says Robert, maybe they don't always write the correct evaluation of the cause of that. But believe me, COVID is real. In my experience, said that, I will say to people, try to protect you in two ways. The first way, the more important, is try to don't breathe the droplet with virus inside. So wear a mask. Any mask, like we did in Spañola, on Spanish pandemia, 100 years ago.
Spanish flu.
Yeah, Spanish flu. Thank you. They were wearing mask, handmade mask, and they used plasma, hyperimmune plasma, and they didn't ever knew what a virus was 100 years ago. They didn't have a electronic microscope, but they stopped Spanish flu. Anyway, wear a mask if possible. Of course, if you are alone in the countryside or in a boat, you don't have to. But if you're walking in the street, you can meet somebody. If you don't have a mask, you can go, but stop breathing for a few seconds when you cross somebody. After that, use vitamin D, high load of vitamin D, or take sun bath. Ivermectin can act with prevention. After that, I'll say at the first symptom, start with anti-inflammatory like aspirin. Never take paracetamol. That is terrible. That lowers glutathione levels. But take aspirin or any fans, nimesulide or whatever you have. Then try to contact a good doctor like Stephen, like me, or a good nurse, and ask her to be treated with anti-inflammatory antibiotics, ivermectin or hydroxychloroquine, cortisone, corticosteroid, and heparin, and you'll get through. But don't say, please, that COVID doesn't kill. It kills a lot. Kills a lot.
But from what I understand, Andrea, you're saying that if you get cured the right way and at the right time with the right medicines, you stand a 100% chance, or let's say, let's be pessimistic, 99.5% chance of survival, right?
Yes.
Okay.
That's what I'm saying. Yes.
Therefore, when you say you have to fear COVID because it can kill you, but like you should also fear cutting your finger and not putting a bandage on it because you could get an infection and die from it. I mean, we're talking the same thing. Basically, right? You cure something and it goes away. You don't cure it, and you run your risk.
Yeah, I say you have to respect.
Exactly.
To the people that are waiting for vaccine, I say, okay, if you think you want to do it, well, take anti-inflammatory before and after for a few days, just to reduce fever or pain or whatever, and stay ready with enoxaparin. The first signs, use enoxaparin to save your life. But if you're not in queue to have a vaccine, don't push to have it. Just wait, because as Stephen says, that everybody knows, those vaccines are experimental. I suppose that RNA messenger will be the new frontier in cancer therapy, like monoclonal antibodies. But they never have been tested largely. So for the big pharma, it's a big occasion to have 1 billion people in queue to test, like there were little mice. So think about it. That's all.
So in general, we know that it takes 2 to 10 years to test a new drug, especially a vaccine, from what I understand. And here we have these vaccines that are being rolled out after 5 months testing. And here in Italy, we actually have a general who was put in charge of the vaccination program. And he said it outright during a press conference the other day. He said these are experimental drugs which are being tested basically on the general population. So people should know before they get a vaccine. We're not telling them not to, mind you, but we're saying know what you're going up against. This is an experimental drug, and you are the guinea pig on whom this vaccine will be tested. Feel free to correct me if I'm wrong, Crystal.
No, we're definitely in the guinea pig stage. And I think it's devastating what's happening to pregnant women right now with their OBs that are pushing them to get this injection, when it is completely unethical to even run tests on pregnant mothers and babies. They have no idea the outcomes or results. And we're seeing devastating aftermath because of this. And then same thing with children. They're setting children up to be an experiment. And I think this is a whole level of abuse in itself, because we don't know the effects even on adults. We don't know anything yet. I mean, these trial runs are running until 2023. We are the human experiment right now, and to sign your child up or your unborn baby, I think is criminal, and I think it's criminal that this is being pushed. And I am going to add, because I am loving this conversation, because it is it's testing me. And maybe this is why I also got fired and terminated for asking questions and speaking what I believe to be true. And Andrea, I love that you're part of this conversation, but I have to disagree respectfully. And again, this may be why I've been terminated. Masks are so harmful. They're so harmful. Please don't put a mask on your face. Please don't mask your child. And I think what I want to leave people with is to get outside into nature. And everything that we have been connected to, everything that we know to be true, is found outside amongst the trees. And the problem is we've disconnected ourselves from spirit, from God, from divine, from nature. And the more we continue to push nature away and push what has been naturally created for us, and thinking that man can do better and man can, create these synthetic everything, the more destruction we encounter. And that includes chronic illness and autoimmune diseases and these conveniences that create, destruction within even our relationships, our mental health. Before this whole pandemic started, we had been in
So you called it a plandemic.
Yeah.
Yeah.
Yes.
A plandemic.
Yeah. But we had been in the wrong trajectory for years. The way society was headed was not sustainable for health or for well-being or for any kind of success amongst humanity. We were driving ourselves into the grave. And I mean, Dr. Zach Bush talks about how we are the sixth extinction coming, humanity. And he predicts, if we don't change our way of living, it's going to be happening in the 60 to 80 years. I mean, we've been, accustomed that we have to, be busy. And I know more so on the Western side. I think you guys in Europe have it a little bit better with your work-life family balance, but definitely where we are in the Western side is we are too work-focused, too hustle bustle. The stress is high, cortisol levels are high. We have no relationships within ourselves. We had already been isolated. Like, let's face it, before lockdown started, we were isolated by our phones, by our mechanisms, by our work. We already kind of pushed relationships aside. And
that's why I moved back to Italy.
Yeah, and I mean, I miss the siestas when I visited. It was in the family meals in the community, and we have lost community for decades, and we've been trying to do everything on our own. And the family life is stressful. There's no work-life balance within the home. You push your kids aside to go to school. There's daycares and after-school care, and when is that time for family unit? When's that time to actually have community, to be surrounded? So we were in a mess before all this. The only thing that this has shown us is just how much help we needed and how much we really needed to change our way of living and to really reprioritize where we were going and what is important to us, what our values are, what our beliefs are. And it really has stripped away all the excess and really has made us come really aware of what's important in life. And that's like meaningful relationships, meaningful connections. That is, a spiritual connection. That is, having conversations like this. That is going outside. That is being connected to your family. So I just want to leave people with just get outside and just reconnect with nature, reconnect with yourself, and to stop all this like fear. Fear doesn't stop you from dying. It just stops you from living. And if we're not here to live, then what are we here for? So I know, Dr. Andre, I know you have a point. That's just where I'm coming from. And I do believe people are dying, and I'm not trying to take that away. I know people are sick. I know people are dying. People have been dying for many different reasons, for many different years. And yes, maybe it's been worse, but I think there's a lot of factors that are pushing what is happening, that we need to look at the big picture.
Yeah, sorry, I should go because I have a meeting with the health authority here in this small republic. And just to let you know, it's around 70 minutes we are talking, something less. And I had something like 25, maybe 30 messages from patients that are going worse, or I'm doing just some better. But I saw, because I'm using my phone, because my AirBook didn't connect to the Wi-Fi, that's why I was late. And I'm using my iPhone, and on my iPhone I can see all the messages, and something are concerning me. So sorry, but I should go and get in touch with them. Thank you very much.
Thank you very much for being with us, Andrea.
Thank you.
And I hope to see you again very, very soon. Okay.
Thank
you very much, Andrea.
Thank you.
Thank you very much. I have to say, you guys are what I call heroes. And I call you heroes not only because you save people's lives, but because you're out there speaking your minds, and you're doing it against, like, you're like swimming against the current, like salmon. Okay. And you have everything to lose. And some of you have lost everything, your jobs, and, you risk losing your reputation, you risk losing your liberty, and God knows what else you risk losing. Whereas you have all these other doctors who get, beautiful, wonderful paychecks to be on television and speak whatever the main agenda is. and they don't risk anything. So, I think people should listen to you a lot more than they listen to people who get paid to say certain things. Crystal,
Yeah, there's really yeah,
sorry.
yeah. I'll let you speak, Crystal. I was just gonna say that there's no, we have nothing to gain and everything to lose here. Um, so we have no advantage in lying to you, and
Right.
we're all doing our best actually to bring the truth to the surface where people can see it. And yeah.
A lot of
Yeah.
these doctors, we know that they have a conflict of interest because they're being or were or have been financed by pharmaceutical companies, and these are the ones who are speaking on television. I mean, we have that here in Italy. We know that there is a strong conflict of interest. Whereas you guys, I mean, if I use hydroxychloroquine, you're not making a cent out of it. So why should you be telling me to use hydroxychloroquine unless it was the truth? Unless you truly believed it and you found it through your studies. Sorry, Crystal, I interrupted you.
No, that's fine. I have a really hard time when I hear somebody refer to me or others as heroes, because in my opinion, I'm just doing my moral duty. I'm just fulfilling my moral duty, and I have a conscience, and I have integrity, and I need to stand strongly in support of, all that is right, all that is true, all that is ethical and moral. And I have to stand very firmly opposed to anything that would cause any kind of harm, any kind of corruption. That is just who I am. I'm a Christian. That's who I am. And you don't necessarily need to be a Christian to feel that way, but I'm just saying that's who that is how I'm made up. And I would never, ever allow even the threat of my career or my license or, my home being taken from me or anything, my life for that matter. I would never allow anything to stand in the way of doing what's right and true, because I will have to answer for my life, and I will have to answer for what I did and the knowledge that I had and what I did with it. And that's just, I won't bow. I won't bow, and I will not stand here in silence and watch people be morally violated.
Exactly. And that's why I call you a hero, because how many people will do that today? I mean, people would not compromise like a lunch at McDonald's to, in order to back away from what their beliefs are. So, I really admire what you're doing. Crystal, or sorry, Kristen. Sorry.
It's true. It's true though that we don't really feel like heroes. We don't feel courageous. We just feel like we're coming into our humanity. Right, we're just being human beings who have a conscience, and that's it. So for us, it's not I don't think it's really a big deal. I think we recognize the risks and we say, okay, that's a risk worth taking. I think it's harder if you're in the hospitals, because then you have another overlord, right, that you're supposed to please. But I think this is going to come down to a world, like a global integrity test, right? Everyone's going to have a chance if you have enough consciousness to know that something is going on. Then it will be up to you whether your conscience is awakened enough, and whether you listen to it, and whether you stand up and show your integrity. That will be the deciding thing for you. So everyone is going to get a chance, right? If they're under the spell, you may not have a chance because you just don't have the consciousness. But if you are not, then you have to make your choice, right? So this is a big test for humanity, and it's got a lot to do with machines. The machine is an on-off button. That's it. It's either or, black, white, yes, no. That's what a machine is. Whereas a human, we have to find out what makes humans different from machines. Otherwise, hey, you can replace doctors with AI. And maybe in a couple of years, I think doctors are gonna be gone, because
that's what 5G is for, apparently, right?
Well, yeah, but what you can do with technology is you can replace doctors. If it's just an algorithm that comes out at the end with a pharmaceutical product, who needs us, right? If you're taking doctors and making them remote from their patients, they never touch them, they don't speak to them, and they're all in hazmat suits. Where's the human connection? So we have to. We're getting a test here, and I guess we're going to see if we pass or fail.
Yeah, I agree. And I can't be bought either. When you spoke earlier of conflicts of interest, I'm sure I speak for a lot of us when I say I cannot be bought. There's no price tag that will make me compromise my integrity and my conscience.
Okay. So I really hope that we will get a chance to speak again, and also, invite more guests from all over the world, because I think it's imperative that we get the message out to people that COVID can be cured. You stand a 100% chance of recovery, full recovery, if you take it in time with the right medicines. I understand that today. And we shouldn't be scared of it, and we should go basically back to our own lives. I'm getting a lot of evidence. People are sending me pictures, they're sending me documentation from hospitals here in Italy. I don't know if it's the same there in Canada, showing me that these COVID wards, these COVID departments are virtually empty, and there's very few people being kept in there, and they're mostly asymptomatic, or they have very few symptoms, which could easily be cured at home. But instead, they're being kept in the hospitals because apparently hospitals are getting a large reimbursement from the government, much more money than they would for any other patients. So they should probably be home. I'm sure that's not the case of all the hospitals, but there's a large number of hospitals that are being shown me that are virtually empty. And I really, really hope that more nurses and doctors have the courage to do the same thing also in Canada and send you their pictures to show what the actual situation is in hospitals. Do you have any knowledge of what the situation is in Canadian hospitals?
It is getting busy now. I've been talking to a lot of our nurses in the ICU and emergency departments, and it is getting busy, but I think that's we've been at this in Canada, like lockdowns, and we're getting like stricter lockdowns of where I'm in Ontario. I mean, that's been over a year of isolating, a year of fear, how Dr. Malthouse talks about vitamin D deficiency. So, their mental health is, a huge at risk. The Children's Sick Kids Hotline has increased by 4 million calls this year. That's 4 million calls in a year that these kids are reaching out for help. So I think, we're seeing a lot of overflow from the effects of these harmful mandates that are in place, as well as, like, let's face it, the injections have been rolling out, and they're now going into younger demographics. And so we're seeing a lot of fallout from that as well. And I'm amazed that connections are not being made, because I know of firsthand experiences from, relatives that, have gotten this injection. 2 days later, one ended up unconscious, ventilated, and passed away. But because they tested positive in between that, they didn't relate it back to the injection. It was because of the positive test. And so there's like still this massive disconnect happening. And I don't know why. Like, it couldn't be more like clear, but I would see this happening in the NICU where I worked, where our babies would be, getting well to go home, breathing on their own, and they'd come up for their 2 months immunizations. They would receive their immunizations and all of a sudden start having spells and needing to go back onto invasive breathing support. And when I asked about it, they just brushed it off. Apparently it wasn't a side effect, or it shouldn't be related, or it was just thought of to be normal. So there I was again, I guess causing trouble for asking questions about why these healthy babies are now going backwards on breathing support. So they don't want to connect.
And the disconnect will be even larger for those that, situations where it's a year, 2 years, 3 years, where they're being re-exposed to the virus post-injection and then dying or having severe adverse reactions because the length of time that has elapsed.
We lost Crystal again.
Oh.
Poor thing. Every time she tries to speak, she gets cut off. Is she back? You're back. Okay, there she is.
Am I back?
Yes, you're back.
Okay. I was just saying the lapse in time between the injection and say 1, 2, 3 years later, when you're exposed to the virus again, and then you see subsequent severe adverse reactions and or deaths, there'll be disconnections made where they won't connect the two and see it as a potential cause, right? And we already see that, but there's further evidence to support that will be the case looking ahead into the future as well.
Yeah, here in Italy, we have the no correlation epidemic, whereas people are dying from these shots and they're being told there's no correlation. But we've seen that there was a 44% spike in deaths of youths from 20 to 30 year old in Israel, who happens to be the most vaccinated country in the world. And that was just in February, a 44% increase.
Yeah, I think it's because the thing is, it's going to affect the younger who have a more robust reaction to the shots and to robust. But I mean, they react to the shots, to prime them for the coronavirus. So they're the ones that are going to be hit hardest when we call pathogenic priming, which is, people be given the shots, and we saw this in animal trials after the SARS itself in 2002. The ones that are going to be the most hard hit from the exposure to the wild virus and autobody dependent enhancement are going to be the young people, right?
Mhm.
It's not going to be the old people. I mean, the old people are going to get bumped off by the shot themselves in the short period of time. But when it comes to the exposure to the wild virus later, where there'll be a gap, it'll be young people. And we had a doctor who just spoke out in British Columbia, the province that I'm living in Canada, where he spoke about some of his patients having facial paralysis and strange multiple sclerosis-like diseases. He wrote a letter to our public health officer in this province, and he was set up to speak to the person who was in charge of adverse events a few days later. He spoke to this other doctor, the one in charge of the program and the adverse events, and she said it was all coincidence. He could not get a neurologist. He couldn't get a neurologist to see his patients. They all heard the word vaccine, and they all said, "No, we don't see those patients." And they even took it to their team, which is all the neurologists at their grand rounds, and nobody would touch the cases. And these people have had their lives destroyed, and that's only the tip of the iceberg. The majority of the iceberg is not being reported. People just think, well, that's normal, or they're being told that it's a sign that their immune system is kicking in, which is a complete lie. Right?
It's actually kicked them out the window.
Effects. Exactly. So the medical profession, I don't think they're even in denial. I think they're refusing. They know that these are adverse effects in their hearts, and I think that they're lying to protect their position, because they don't want to interfere with the rollout. Maybe they believe that this rollout of vaccines, so-called vaccines, is good. But I haven't seen anything good come out of it.
The way I see it, even if you stand a small chance of dying from the vaccine and someone forces you to have it, like they're doing here in Italy for all medical personnel that are being forced to get a vaccine, it's like forcing you to point a loaded gun to your head and say, shoot, like Russian roulette. It could kill you. We don't know if it will, but you have to do it. Why? I mean, isn't that unethical? Isn't that illegal, unconstitutional? Goes against the Nuremberg trials?
Yeah, it is against the Nuremberg Code, because first of all, we are in a phase 3 trial with inadequate animal studies, and we don't even know the ingredients of these shots. Mm-hmm. Which doesn't have to be revealed to the end of 2022 for Moderna, and 2023, I think, for Pfizer, beginning. Exactly. And so if we don't know the ingredients, how is it possible for your patients to have informed consent? It's not possible. So there we've, again, broken the Nuremberg Code, and we're not even telling people they're in an experiment. So, there's going to be some trials after this, and a lot of doctors and a lot of experts are going to be in the dock, and we will see.
Well, let's hope we do get around to getting people to court for what they've done. Unfortunately, a lot of people will have gotten sick or have died in the meantime. Let's hope not that many. Let's hope as few as possible. But eventually, someone is going to be called in to answer for all this. Anyway, I wish to thank you all for being here today. I hope to be able to talk to you soon. And as I said before, let's try to expand this dialogue, this conversation with other doctors around the world, and try to get this one world protocol put together, so all the doctors can try to pressure their own governments to have it accepted and end this emergency, which has no real cause for being. Thank you very much, Stephen. Thank you so much, Kristen and Crystal. It was wonderful to talk to you, and I hope to talk to you soon.
Wonderful.
Thank you very much.
Thank you so much. Have a wonderful day.
Bye.
Thanks.